Welcome to another edition of This is Public Health, a podcast presented by the Illinois Department of Public Health. Each new edition focuses on an area of public health and programs and services that affect you. This week, we're pleased to welcome Dr. Maura Quinlan. She's the Women's Health Medical Advisor at IDPH. And Dr. Quinlan, thank you so much for taking the time.
Oh, my pleasure. It's an honor.
Well, as we are focusing on women's health, but also on maternal health, a big focus right now here in the state of Illinois. So let's talk about some of the overall programs available to support healthy pregnancies and healthy babies.
Yeah, happy to address that. There's so much being done in the state, which I'm really proud to highlight. The health of pregnant people in the state obviously is extremely important. Illinois has a very robust maternal mortality review committee, which is IDPH funded and looks at every single death, the tragic deaths of a pregnant person during pregnancy or within a year postpartum. Every single one of those cases is investigated in a group setting that includes physicians and policy people and many people who are in that space to look and see if there's patterns that can help prevent those cases in the future. And because of that, that has led to a lot of resources and efforts in the state to help decrease those cases. In addition, the Office of Women's Health and Family Services, which is one of the oldest of its kind in a state health department in the country, has multiple programs that focus on healthy pregnancy. So to talk about some of the programs, there's something called the Regional Perinatal Network, which is a way that every birthing hospital is connected to a higher level, a more tertiary care hospital, so that these smaller hospitals are linked. There's ways to do quality, to make sure the quality is consistent and across every single hospital. IDPH also supports the Illinois Perinatal Quality Collaborative that we call ILPQC. Everything has initials, which is also a nationally recognized network of hospital teams, clinical folks, patients to address issues as they come. So they have a variety of initiatives that they've worked on recently. They've worked on decreasing the number of C-sections, favor vaginal delivery, working on educating providers on the newest approach for hypertension, safe sleep. So there's a variety of programs that come from IDPH, and it's quite nimble that whatever seems like it's affecting pregnant people in the state, that issue is addressed moving forward.
As you mentioned, the maternal mortality and morbidity, and this is an area that I know we have done a lot of work on at IDPH, and in particular, looking at some of the disparities in various groups. As we're speaking right now, this is Minority Maternal Health Month, and this edition is actually coming out during Black Maternal Health Week, and that major focus has been on correcting these historic health disparities among racial categories. So what's happening to make sure that these programs and services are available and accessible in minority communities?
That's a great question because it's extremely important, and there's a great disparity. Black women are more likely to have complications or even die in pregnancy nationwide that compared with white women, and that's no different in Illinois. So there's the effort, and Governor Pritzker announced recently the birth equity funding. Birth equity is sort of a general term that means everyone should have the same access to high quality care across the state, regardless of anything that might make them at higher risk. So there's birth equity funding that will include things like doulas, which are funding a birth labor support person, funding breastfeeding support. They opened a great birth center on the south side of Chicago, which is long overdue. The Office of Women's Health and Family Services is really looking at an equity disparity focus with funding to make sure community-based organizations get the funding they need that they may not have in the past because they're perhaps a smaller operation. So there's definitely an effort to increase the funding and working with national level organizations to look at systems to ensure health equity is a focus, especially through all the programming. So kind of every one of the programs I mentioned, and there are many more, have this focus of equity, like how are we reaching the people who need this the most?
One particular maternal health issue we've been hearing a lot about recently is congenital syphilis. If you could please explain what that is, who's at risk, and how it can be prevented.
Syphilis is a sexually transmitted infection that's been around for hundreds of years. Congenital syphilis in particular is when that infection happens during pregnancy. It crosses the placenta and the baby is born infected. There's many levels of tragedy with congenital syphilis. It markedly increased the rate of stillbirth, so the baby dying before birth. There can be a risk of preterm labor. Babies can be born with some bone and teeth abnormalities, some developmental delay, trouble learning. And the tragedy is that is prevented by penicillin, a variation of penicillin called, the trade name is bicillin. We know exactly how to cure. They make that baby not affected, but it's a challenge with access. So, and people getting tested and treated appropriately. The reason why it's been in the news is the numbers are increasing. So at the turn of this century-ish, the early 2000s, they thought that maybe it was gone. The number of congenital syphilis, for example, in Illinois in those years was maybe 10 or 15 or so per year. In the last few years, it's just going straight up. It was, in the 20s, in the 30s. Last year, they were in the 80s, about 84 babies born last year in Illinois with congenital syphilis. There's just been a lot of effort, like we can do better. We have to do better at figuring out the problems and coming to some solutions.
And is this a situation where a pregnant person may not even be aware they have this infection and therefore just unknowingly is transmitting it to their child?
Correct. The syphilis has many stages, and there's a variety of clinical findings at those stages, but the symptoms are pretty subtle. We test every single pregnant person at their first prenatal visit and early in the third trimester. Every pregnant woman by law is required to be tested twice in pregnancy, just in case she got it during pregnancy so that there's still time for treatment. But you're right. Many pregnant people have no symptoms. And then that stage where someone has already had the symptoms, didn't notice it, and it passed. But the penicillin is the only treatment, the bicillin, but it has to be a shot. It's not an oral pill. It's an injection given in the office, which makes it a little bit of a challenge because most people are at the stage that they need 3 shots 1 week apart. And, life gets in the way and can be tricky for people to get that treatment. I'd like to add something else that the state is doing for congenital syphilis to try to reduce this rise in cases. As I mentioned, it's really hard as a provider to know exactly how to treat patients with syphilis. We know the treatment is a penicillin, but how many doses, et cetera. So in November, Perinatal Syphilis Warmline was launched. Warmline, different from a hotline in that calls are answered within 1 business day instead of immediately. It is intended for providers to have a single number to call to say, can you help me? Here's her labs. Here's her symptoms. I just need confirmation about how to, get some clinical guidance. The beautiful thing too about the Warmline is they also have access to the state data. Anyone treated for syphilis, their treatment, their past testing for syphilis is known. So the Warmline can help link providers to that information to help make the diagnosis, can help them report to the state health department. The other states have been reaching out to us to say, tell us about your Warmline. But if anyone's interested, if you, again, Google Illinois Perinatal Syphilis Warmline, it's just a single number and it connects to some great resources. We all know it's hard to make that diagnosis, so providers should call for that help if needed. It's a great team that will help them.
You're listening to This is Public Health from the Illinois Department of Public Health. Our guest this week, Dr. Maura Quinlan, Women's Health Medical Advisor at IDPH. Looking ahead to the month of May, it is Maternal Mental Health Month. We've talked a lot about programs to support the physical well-being of pregnant persons and new mothers, but what about their mental health?
As I mentioned before about the Maternal Mortality Review Committee really showing what the problems are, that committee looked at tragic deaths in the state, has shown that mental health and substance use disorder, which often are intertwined, together account for 40% of the pregnancy-related deaths in Illinois between 2018 and 2020. So huge number that's related to that. So I've only been at IDPH for a year, and I'm so impressed with what I've learned. That's to help in that area of mental health. There is an Illinois Moms Hotline for pregnant and postpartum patients who need immediate access to mental health support. There's something, the Illinois Helpline, and listeners, if you Google Illinois Helpline, you'll get to it. It includes a medication-assisted recovery portion, so that line will connect people to counseling, to referrals for medication assistance if they're ready for opioid substance use disorder. May is Maternal Mental Health Awareness Month, and so there's a campaign that will be more public-facing to shed some necessary light on this important issue.
We've talked a lot about these supports for people during pregnancy, but obviously IDPH also has and supports a lot of programs to promote and protect women's health outside of pregnancy. Can you talk about some of those other areas in which you focus on the optimization of women's health?
Sure. The Office of Women's Health and Family Services has really, throughout the lifespan, supports school-based clinics. One of the things we know can increase the chance of a healthy pregnancy is to have the birth spacing in the way that the pregnant person wants. So So to be able to not have kids when she wants. So, in time, her pregnancies that are best for her life. So family planning, access to contraception is hugely important there. So the Illinois Family Planning Program includes Title X, which is federally funded, and a recently expanded Illinois Medicaid for people in Illinois specifically to access low or no cost contraception. So that's one. There's the Illinois Breast and Cervical Cancer Prevention Program that's also funded for women to get mammograms, pap testing, who can't otherwise afford it. And then there's something called Wise Woman. That's a national program that helps women get preventive screening and personalized risk reduction and health coaching. As a provider, I didn't know as much of those as I wish I did, because I know I have patients who could have benefited.
A lot of information here, a lot of programs, and as you noted, a lot for anyone to keep track of, whether a woman who just wants to improve her health or a provider who wants to assist their patients. So people who'd like to know more about these programs, where can they go to get more information?
If you just Google IDPH Pap smear, you will get connected to the Illinois Breast and Cervical Cancer Prevention Program, which will tell you where in your area is a provider who can offer this low or no cost screening. So I think the IDPH website is great. For those who want to get involved, there's a group called EverThrive, which is a community-based organization that has IDPH support that advocates for the health and safety of Illinoisans, supports access to quality health care and resources. They are having a maternal and child health family council, and they're wanting new folks to participate, to help give feedback and help shape women's health programming in the state. There's also a little stipend for people who attend the meetings. So EverThrive, it's everthrive.org is their website. And when you go on, if you look into the family council, there would be a way to sign up there. So our website is a great place just to see, where can I find out more about these things and get more information.
So again, dph.illinois.gov, the Illinois Department of Public Health website. You can do a search within that for all these different programs. Also, that other website, everthrive.org. Dr. Maura Quinlan, Women's Health Medical Advisor at the Illinois Department of Public Health. Thanks again so much for your time, for all this valuable information on women's and maternal health. We really appreciate it.
Yeah, you're welcome. Glad to share all the work that's being done by some great teams.
Please join us next time for another edition of This is Public Health with the Illinois Department of Public Health.